I'm a nurse. I'm a nurse at the hospital in Amsterdam. From little on, I always knew I wanted to be a nurse. When a patient gets really ill, really sick, or almost dying, at that point we have to help them. And from that moment on, I knew I want to be a nurse for the intensive care unit. The ICU is a matter of life or death. The knowledge, you have to know so much about machines, about patients, about kind of diseases. The first patient with COVID-19 coronavirus who entered the ICU ward was more sick than normally people are with lung injuries or lung infections. We never seen someone getting so sick so quickly in a short amount of time. When the first patient died, it didn't matter what we do. The settings on the breathing machine, we turned maximum, we give medication, and all the things we did, nothing helps. So she was literally slipping through our fingers. The reason I made the picture for me with the monitor and the breathing machine, I thought, people, you have to pay attention. This is not a normal situation. The numbers of likes and reactions and sharings, it was insane. I've never expected to be that big. The power of social media was really great, because that was for me an opportunity to reach the people in Netherlands and across Netherlands. 4 days before I got my PCR test, I was getting symptoms, so a running nose and a cough and sneeze a lot. And when they told me that I was positive to coronavirus, my first reaction was, and what now? What's going to happen? And you hear that young people don't get sick that much, but I knew better because I already saw an 18-year-old boy at the ICU ward with the coronavirus, so I knew also younger people can get sick. And a week later, I got really sick with fluids in my lungs and short of breath. It took me 10 weeks before I could go outside. That ill that I couldn't even go outside of my house. After your illness, you can't do anything. When I started to feel better again, I thought, okay, now you have to go sport and walk and train and everything to get better again. But the more I exercise, the sicker I get again. And that was a sign that I thought, what's going on? One of the tests that says I have only 50% of my lung function. So basically I'm just breathing with one lung. Nobody could tell me van, Emma, it's going to be fine. Now I'm feeling better and I can walk and do things again. The only time you can do more in activity, it's with the therapists. When I exercise, I have the same routine. I start with 10 minutes of the bicycle. After that, I do the leg press. Then I do the seated row and the lat pull. And after the lat pull, I do leg curl and the leg extensions. And the difference between my own rehabilitation and the Hero, it was like on a screen. So you can see things and do things at the same time. So the time they passes by quicker. At the treadmill, I saw the 100% score I made, and that's what I want to keep. When you have a game to play, it's more exciting and more challenging. You just want to finish the game and it's 10 seconds left. Okay, you can do it. And then you push yourself further than you will normally do. It gets your mind off that you actually are walking on a treadmill or doing other exercises.
Motec. Improve human performance.